Hey YouTubers and preppers. I've had a number of requests about CPR in the wild and during disasters. So in this video I'm going to cover a little bit about CPR and the basics of that. But I am doing a big video about the more advanced CPR and resuscitation in different situations. But just to keep you at bay for now, I'll give you a basic one. Okay. CPR is when you would perform this when somebody has stopped breathing and their heart has stopped beating. So clinically they are dead. Okay. The aim of CPR is to get the heart started again and to get them breathing again. I must warn you, it is not like ER or Grey's Anatomy. When you finally resuscitate somebody and they wake up, they're not going to get up dancing around, okay? This is not how it works. If your heart has stopped beating, you need a few days rest. Trust. Okay. What you will need to perform general CPR is gloves, awesome stuff. You will need a pocket mask, which I've shown you in one of the videos. You can also get these, which I'm sure some of you will already have. They are the masks in the box. Okay. However, if you have, this is even better. Okay. General CPR. If somebody has stopped breathing, you check the ABC first. Okay. So just to make sure they stop breathing and to make sure they are dead, you shout their name. So, or you get their attention somehow, or try to get their attention, just to make sure they're not unconscious. Some people have very faint heartbeats and very faint breathing patterns, okay? So it may seem like they are having a cardiac arrest, but they may actually just be asleep. So double check first. If they can't wake up, then we perform ABC. ABC, airways, okay? You lift the head and you look at the chest. You put your face, so your ear is to their nose, okay? And you listen for breathing and you see if their chest is going up and down. You check, this is breathing also. C is for circulation. If you can't get a pulse, then there is no circulation. This is when you perform CPR. Okay, so what you want to do is you want to make sure that the person is on their back and on a sturdy surface. If they're on something like a mattress, this is not going to work. You need to get them on a hard floor or a hard surface. What you need to do then is you need to, if they're wearing something like a lab coat, you need to take this off. You don't need to take off the top. If it's thin enough, this is fine. Just so you can touch and get through to their chest. You then need to identify where the ribs are. Okay. This is if you have time. Okay. If you have time, you feel for about the third rib down, which is here, just below the nipple. Okay. Move your finger right to the middle with the palm of your hand. Put it here, and with your other hand interlock, so it's like this. You then have to make sure that your arms, so you have your hands like this, and your arms are locked. Do not have them bent, they must be locked. Push down on the chest in this way. So the heel of your hand is sticking above the heart, and you push with your hand like this. Don't be scared about going too deep. You're aiming for about 1.5, maybe 2 inches down. However, 2 inches is very rare. So maybe 1.5 inches pushing down on the chest. Okay? You want to do this 30 times. So 30 times you do a compression. And then you need to give 2 breaths of life. You can do this using a pocket mask, or you can use one of the resuscitators. So example for the resuscitator or the pocket mask is very similar. You place the mask over the person's mouth and face, and you push 1 and 2, okay? And then you continue compressions. You do another 30. If you are using one of these masks, most of them nowadays are one-way valves. So when the casualty exhales, which they do naturally, it's not going to come back into your mouth. So you put this over the casualty's face and you breathe into this tube. 1 and 2. Awesome. If you are trained, only if you are trained, you can use an airway. So I'll give you one for an example. This is an example of an airway. You put it into the mouth, into the back of the throat, and you twist it round. Then the airway is completely open. This you have to make sure you are doing all the time. When the person is on their back, you need to lift their head back so it is tilted like this. If not, airway is blocked, and more than likely when you're giving your breath of life, the full amount of air, if any, is getting into the lungs. That is how you do CPR. You repeat this process again and again. If you are more than two people, more than one person, if you are two people, one person can do the chest compressions while one person administers the breath of life. However, when the compressions are down, do not give a breath. Only when you are retracting the compression, then you will give the breath of life. The reason you do this is because you're putting so much pressure on the chest by pushing down, you'll be putting even more on by filling up the lungs, and you do not want to do this. So only when you're retracting the compression, you give the breath of life. So it is 30 to 30, not 30 to 2. And then you swap around when you get tired. However, this is all in the ideal situation. More than likely, you are not going to be around your resuscitation mask, you're not going to be around your gloves, etc. If you're not around your gloves, okay. Make sure your hands are clean. If you have some water or anything anywhere, just to clean your hands. Maybe some leaves can clean, eucalyptus for example. Just make sure they're not dirty. If you have no masks, you can always use your coat or your t-shirt or whatever you are wearing to give the breath of life. You do not want to make mouth-to-mouth contact. In a disaster situation, people are going to be covered with diseases, and you do not want body fluid. So if you have something, tissue, absolutely anything, as long as it has tiny holes in it, you can put it over the patient's face or mouth and give your breaths that way. This will reduce the chance of you getting an infection from the patient or you transferring an infection to the patient. If the patient is wearing false teeth, if you can remove these, do not remove these. Okay? Keep them in place if possible unless they become a potential choking hazard. Then you must remove them. The reason you keep false teeth in place is because it keeps the structure of your face. If you remove false teeth from a casualty, the face will sink in and it will be a lot harder to make the seal for the breath of life. If you manage to get a heartbeat and the patient is breathing again, then you put them into the recovery position, which I will cover in a later video. However, the recovery position is you turn them onto their side. So their mouth is open by the knuckle of their hand, like that. Okay, this allows any excess fluid to drain out and they do not choke. But they must be on their side, not on their back. Keep the airway open by tilting the head back always. Not so back, not too far back that it damages the back of the neck or the nerves, but just as far as it will go. Do not force it any further. That is how you perform general CPR in an emergency survival situation. There are other ways such as defibrillation and you can give the fist of life, okay? And this is not what you may think it is. It is where you actually punch the person in the chest like this. This is to start fibrillation in the heart if it has stopped. It's like the original electric shock, the original defibrillator. However, I would not recommend you to do this, as you may crack a rib and you may puncture a lung or worse, puncture the heart. Only do this if you are around a trained professional to do this. I will never explain to you how to do this because I would not like to put anyone's life in risk. Just do the 30 compressions, the 2 breaths. Hopefully that has answered your questions of how to perform CPR in the wild. In a disaster situation, once they are breathing again and their heart is beating, you need to transport them from the area they are in. If they are in the open, you need to get them out of there as soon as possible. Now that their heart has started beating again and they are breathing again, this is perfect. However, they have been clinically dead and bacteria has gone into their body. So you need to get them out of the open and you need to keep them observed for at least 4 days afterwards. Keep checking their pulse and keep checking their blood pressure. Make sure the blood pressure is in range, make sure the temperature is fine, make sure their general health is getting better. And that's it. If I haven't covered anything in this video about CPR, do not worry, I will cover it in more detail in my upcoming video of how to perform survival CPR in different disastrous situations, as it can vary, whether if it's a plague or a nuclear war, etc. If you have any further questions or you want me to post a video, feel free to drop me an email, which is on screen now. It's PredMedical@outlook.com. Yeah. Yep. Just checking. Alright. Okay. For now, I'll see you soon.